You might be walking around with cervical cancer and you don't even know it. Hi guys, my name is Peace. Welcome and welcome back to today's video. If you're coming across my face for the first time, please kindly like this video, share this video and subscribe because you're going to get nothing but value. Let's dive right into the video. So, what is cervical cancer? Cervical cancer is a condition whereby the abnormal cells in the cervix grow like very rapidly and leading to tumor. The major organism implicated for the cause of cervical cancer is human papilloma virus. Do you know that cervical cancer is the fourth most common cancer among women all over the world? Yes, it's that serious. Now, is it preventable? Yes, it's very preventable. The number one and most effective way of preventing cervical cancer is vaccination. There is a vaccine called the HPV vaccine. What are the symptoms of cervical cancer? Someone would ask, if you say I'm walking around with cervical cancer and I don't know, what are the things I need to look out for to suggest that one might have cervical cancer? Number one, unexplained vaginal bleeding. Number two, painful sexual intercourse. Number three, severe lower abdominal, pelvic or back pain. If you are having any of these symptoms and you cannot actually point to something that you think might be the cause, please run to your doctor. Also, how is this treated? There are many mechanisms that could be employed in treating cervical cancer. It could either be chemotherapy, it could be surgery, it could be radiotherapy, or even immunotherapy. Now, let's go back to the other ways to prevent cervical cancer. Like I said before, vaccination is like the one and most important way of preventing cervical cancer. However, there are other things that goes along with this. This also involves regular cervical screening. What do I mean by regular cervical screening? This is a procedure that includes a test called pap smear. So let's dive fully into everything that has to do with pap smear. When you go to your doctor or healthcare professional, you are going to be asked to lie down and you'll be placed in a comfortable position. Your doctor or health professional will use a speculum to retract the vulva and be able to see the cervix. Now with a specimen container, they are going to obtain like a small sample of tissue which is going to be sent to the lab. When this is sent to the lab, it takes around 4 to 5 weeks for the results to come out. Now the result is going to be one of these three things. It's either it's going to be HPV positive, HPV negative, or HPV positive without abnormal cells. It could also be HPV positive with abnormal cells. Now, if it comes out HPV positive without abnormal cells, that's okay, because all your professional would do is book you in for a follow-up test in 1 year time to check that these abnormal cells have all there was no abnormal cells, right? So they'll book you in for a follow-up in 1 year time to be sure that there's no abnormal cell, and maybe the virus itself must have cleared off, because most of the times the HPV virus itself tends to clear off within 1 to 2 years without any medication or without the need for any treatment. So number two, if it comes back that you are HPV positive with abnormal cells, then your healthcare provider would go further to book you in for another procedure, which is called colposcopy. This is where they are going to use special equipment to try and remove the abnormal cells, just so that it doesn't grow or multiply, because if it does, then it's definitely going to lead to cervical cancer. The follow-up investigations, the time for checkups and everything that comes with it would also be communicated to you via your doctor or your healthcare provider. So if you have come across this video, what should you be doing? Go get the vaccine if you haven't. Number 2, go for pap smear. That is like one most reliable way to actually, check if you're even exposed to this. And don't say it cannot be me, because it cannot be anybody until it is somebody. I hope this video has helped. If you have any question regarding cervical cancer, how to prevent it, treatment, everything, just drop it in the comment section. And if you gained any value for this video, kindly let me know. Give this video a thumbs up. Please kindly follow this channel, and I'm sure to bring you more amazing content. Thank you. Until I see you again next time. Bye.